for joining us.
Yes, my pleasure. I'm happy to be here.
Yes, and I love your perspective. You're a board certified pediatrician and you've seen patients obviously with various things kind of coming into you, maybe even just a general checkup and not really knowing if there's anything going on. And so kind of shift and explain how that's changed for you since doing some of the courses on Amen University.
Okay, so yes, my perspective with treating kids has has really changed. So I saw Dr. Amen's course, the brain health coaching course, and I was like, I gotta do that. And that's because I have a brain story myself. When I was at college, actually, I had my first car accident at about 13. And then I had two more at 17, so 6 months apart. Like on the 6-month anniversary of the first one, I had the second one. And so I started not doing well in school. So I was sent to see a neuropsychologist who asked me what I'd like to do. And I told him I wanted to be a pediatrician. And he told me, you will not go to medical school because you have brain damage. So at first, I believed him because he's a doctor. What do I know? But yes, and I did proceed to not do well in school. I had to withdraw from college that semester because I just wasn't doing well, depressed and the whole 9 yards. But I slowly came back, and just with the support of my family and just trying to stay healthy, I got back into school and here I am. So once I saw the brain health coaching course, I was like, I gotta do that. I was like, wait. And the fun thing is I had buried that story, that part of my life for years. I mean, I never even told anybody this tale about me having car accidents. But once I saw the brain health coaching and I read through it, I was like, oh my goodness, this has happened to me. I know I can help other people. And so with that, and then I discovered functional medicine, which is getting to the root cause of diseases, of illnesses. So it changed my perspective in terms of a kid comes into my office and they say, teachers send them or the parents think they're extremely hyperactive. So it's no longer, well, why is the kid, or what did the kid do? Now it's what happened to the kid. Because then I learned about how adverse childhood experiences affect the way kids act and the way kids behave. And you got to ask the parents themselves what happened to them, because passes down in generations, gene changes happen, and then we end up with the kid who's having behavioral issues. I mean, it could just be as simple as what's going on in the environment at home. So yes, my long story to get to the point that yes, my practice perspective has completely changed, because now I'm more looking at what's the root cause, how can we really help these kids without just throwing stimulants or medications at them? How can we help their parents get better so that the kid gets better? So yes.
I love that. And I wish we could just clone you and put you like all over because you're right in the country. Pretty much. Where you are in Oklahoma, you're almost in the very direct middle of the country.
Yes.
What would you say are definitely the ACEs, the Adverse Childhood Experiences Assessment, is huge. One of million goals of what we do is having all pediatricians using that assessment because it's so important, and it just makes me so happy that you're doing that. What are some of the other big takeaways that you have had with patients, especially with ADD and autism, after just what you've learned through functional medicine and then also what you've learned from some of the courses?
So I going through the Hokehe Autism course, that's amazing, because I was like taking notes. I was like, oh wow, I can apply this. I can talk to my parents. I already have a list of parents I've talking to and making small changes with their diet, and I'm already sure I'm gonna see results. So I mean, even just what I learned from the brain health coaching course, and I started applying it to my patients, I'm seeing tremendous changes, like in the moms, telling the moms about their brain health and seeing their eyes light up like, oh my goodness, I didn't know that. And then I give them homework and then they show back up. And voila, the moms are better. And yeah, my visits now turn into, they now sound like a coaching visit for the mothers, because I found that if I can get to the moms, then the kids will do well. So I no longer just say hi, mom, and leave them there in the corner and talk about the kid. I really, really talk to the moms now. And I found that just what what I learned in the brain health coaching by itself has really helped me and has changed pretty much the way I practice. So, and taking the autism course and the ADHD course, wow. I went through the cookbook. I was like, oh my goodness, if I could just, I can see myself already implementing that with the patients, just one thing at a time, changing one small thing. Because with the population I see, a lot of them are on Medicaid, and the first objection will always be it's too expensive. But with all the reading and research I've done, I know that there's ways around eating healthy that's not expensive. It's just the mindset that, oh, I'm not going to buy that because it's $2 more. But when they understand the cost to their bodies and to their kids, then they're more likely to make the small change. And I found that it definitely works. So I would encourage anybody to go take those courses, the ADD and the healing autism and the brain health coaching. Amazing.
I love it so much. It's just so amazing what you're doing. And when you're talking to moms, it was just making me think of some of the people that I met in the clinic when I was doing intakes. And I mean, the divorce rate for parents of children with ADHD and autism is very high.
Yes, it is.
And when you're taking them into your office and helping kind of just treat them too, I mean, you're really treating that family, future generations. It's like magical. It's so amazing what you're doing.
Yeah, it makes me feel good too, and I feel happy too. So even if I was like feeling blah, then I go in and I can help a mom and I come out feeling better. So it definitely works both ways. So yeah.
It's fantastic. And with the nutrition piece, I think a lot of people don't realize how much sugar is in everything, and high fructose corn syrup and the fake sugar that, so long and so many letters you can't even pronounce it. So just that one little thing can make such a huge difference on the brain.
Yes.
And it's really just the education piece, which you're giving your patients, which is really amazing. So I know a lot of doctors, they don't give their patients the time and attention that you do. So it's really fantastic.
Yes, I mean, I've learned and I've decided that that's the way to practice. I mean, it really is. Otherwise, we're just doing slap on the Band-Aid medicine, which really doesn't help anyone in the long run. So,
yeah.
And I read this quote by Maya Angelou that your legacy is everybody you touch. So am I really touching them if I just take like hurry and do that, or if I just spend 5 more minutes and talk to the mom directly? And so I always remember that every time I want to go in there and race out the door, that I really should ask this mom how they're really doing. And that will help prevent a lot of things. I mean, children going into foster care. I mean, taking that little time to talk to a mom can hopefully prevent them from hurting their kids and kids ending up in foster care. Because I also run a nonprofit for foster kids. So it's like that whole connection. I mean, we have to start with the parents. So yeah, it's critical.
So I love what you just said. It made me think of two things that I wanted to share. So one was just me if I didn't know you and I just was walking down the street and I was like, oh, I'm in med school, I want to be a pediatrician, what you would say to them, knowing what you know now. And it made me think of this beautiful article. I don't know who wrote it or when they wrote it, but it was called Why Doctors Are Late. And it was because of things like taking those extra 5 or 10 minutes to really give those people the attention that they needed that can't squish into a 25-minute med check. So cool. And I kind of cut you off. Go ahead.
Oh, no, I agree. I guess I run late these days. What can I say?
What would you say to somebody that was going through med school right now, knowing what you know?
I would say, wow, if there was a way to add in some functional medicine training while you're going through med school so that you have a broader perspective and we don't just come out with the narrow focus we have of the way we are trained in conventional medicine, which is just treat the symptoms. Now we really need to look at the cause and the root cause of what's going on. And it can be so simple as take out milk, drink almond milk. So yes, I would definitely tell anybody I came across, for sure, we need to get some extra training in and just broaden your perspective that way, and always ask why, and not just be happy with, okay, this is what they said it is, and boom, I'll just treat that. Just ask a little more questions. Ask the parents how they're doing. I mean, really, when you see somebody, you shouldn't just treat the one person. It's what's also going on in their environment, in their family, in their background, and all of that. So
You're amazing. Thank you so much for sharing.
you're welcome.
Anything else that you wanted to share? You were so great to take time out of your crazy busy schedule as a doctor and someone running a nonprofit and a mom to
yes. talk. No, my pleasure. I mean, I'm so happy that I went ahead and I completed my brain health coaching. So just to anybody who's thinking about it, it's definitely worth it. And just the fact that you learn how to treat people in a holistic way, and you learn simple strategies that can make such a big difference in the people's lives, because everything we do is a ripple effect. Whatever we do for one person, then they get better and they take it and they run with it. And so it's just us as medical professionals just being more aware of the fact that we have to look at people in the whole sense, not just in one area or whatever it is they say to you right now. So,
well, thank you so much for all you're doing and making time for us on a Friday afternoon. I appreciate it. And I'm so excited to open in Dallas in a few months. So I don't know if I'll be able to meet you, but I know some of my colleagues will. And
yes, I'm looking forward to that. That would be great.
Me too. I'm excited.
Yeah.
Awesome. Well, I hope you have a great weekend.
Okay, you too, Fallon. Have a wonderful time. It's my pleasure. Thanks for having me on.
Thank you so much. It was our pleasure.